Dr. Lewis, and thank you for coming to talk about another aspect of the work that you do.
Thank you. Thank you for having me here.
So I'd like to start by asking you, how did Veterans Health and Wellness Foundation begin working with American Diversity Group?
Wow, that's been a while ago. I met Mayor Moody, Mr. Moody, while I was doing a education and training class at one of the hospital facilities. And he heard the information that we were presenting, etc. Got very interested because the focus was on veteran and veteran health. And so afterwards we had a conversation. He came up to me and mentioned his interest in that, told me a little bit about the work that he was doing with his foundation. And we then made a time to talk even further down the line about perhaps how we could work together. And he could include the veteran population in the work that he was doing.
Okay, so can you tell me a little bit more about that partnership and the collaboration of activities that you've both enjoyed?
Sure. After our initial conversation, he invited me to one of his health fairs. And I will tell you, as a physician, health fairs give me a rash because we typically invite people to those kinds of activities, and those people who come are very much in need of what's being offered there. But we will often tell them, you've got hypertension, or it looks like you are diabetic, you need to go see a doctor. And typically the reason they're at a health fair is they don't have access to that. And so in attending this health fair he invited me to, it became very clear to me that it was one of the most comprehensive of health fairs that I'd ever attended. Not only were people being screened for various diseases and what have you, but it was really comprehensive in that it wasn't just lab work, it wasn't just diabetes or hypertension, it was mental health, it was dental. All of those components were included. And not only did they get those screenings, but he actually had others there, i.e. physicians, that would then set up appointments that would follow up anything that was found to be an abnormal lab or what have you while we were at the health fair. So that to me said that this is someone that we could really work with in terms of providing the kinds of services that we look to provide for veterans.
Sounds like an outstanding opportunity to view something like that, and no wonder that you would want to continue to have that type of partnership and work together. What are you looking for future? What's the plan? What ideas or thoughts do you have for that ongoing collaboration of activities?
Well, since we've come together and begun working as partners, we've been engaged with and invited to participate in a number of the activities that they've had through their foundation, which have included additional health fairs. Obviously now in this time of COVID testing, and we're looking actually forward to the point in time where we can offer COVID vaccines. And so one of the activities I think that I will be most excited about is that as we move forward throughout the year, many people are aware of November being Veterans Month. It's now become known as Military, Family, and Veterans Health Month. We look to partner to really do a more extensive event where more and more veterans are brought to the event, and again the focus will be on health.
Great. It sounds amazing. I'm so glad that the two of you, your foundations, have found one another. It sounds like it's going to be a great benefit to communities and veterans and their families.
Well, it has definitely been that already. Again, with veterans, and I'm glad you mentioned that last word of families, because we very much have to include them because they also serve when the veteran serves.
Absolutely. Again, Dr. Lewis, thank you very much for being here and sharing more of the important work that you are doing along with others.
You're more than welcome. Thank you for the invite.
Thank you.